So a lot of people have questions about the coronavirus, understandably. Dr. Mandeep Walia-Bhatia is here from the Gain Wellness Center to give us some tips and really help sort out some of the concern that we're seeing. Dr. Walia, thank you so much for being here this morning. So we really want to start with, first of all, just educating people. There's a lot on social media, which is the last place you should probably pay attention to.
Yes.
But there is this idea of you have one group that says, oh my gosh, and is panicking, and then on the other end of the spectrum you have, well, more people die from the flu, this isn't that serious, why are we hyping this up?
Yeah, you bring an excellent point, because there is a lot of confusion and people just don't know if they should panic or they should totally just relax. And I think at this point we know enough that we need to be concerned, but we don't need to panic. We need to prepare. We need to educate ourselves about this. And also CDC as well as San Diego County website are some great web pages where we can get some information that's actually more legitimate than going on social media. And so definitely we know enough by now. Obviously it's a new virus, new pathogen, so there is still a lot of research that has to be done. But it's here, and we're going to see more and more people getting infected with it. So again, number one thing still remains prevention. It is, and it will always be the best medicine.
Okay, so you bring up a great point that people are paying attention to this, and we should be concerned and maybe change our habits a little bit, because it's a novel coronavirus. It's a new virus, which means we don't have immunity to it.
We don't have immunity, and also we don't really know exactly the terms, and we don't have a vaccine, we don't have any drugs to treat for it. So if somebody does get infected, really there is more supportive care that can be given. But from CDC, we know enough about the data, people who have been infected, that elderly people, people who are older than 60 years of age, people with pre-existing conditions with heart disease as well as lung complications are more prone to this if they do get infected. So what I would say is really take this information and then apply it to yourself. See what your risk factors are. If you are an elderly, somebody with immune compromised health concerns, somebody who has underlying heart disease, diabetes, or you have some lung complications like asthma and allergies in your medical history, then you want to prepare yourself a little bit more and really prevent, first of all, getting this flu if possible.
And for the rest of society, it's really about being more considerate to those individuals and showing support to those individuals, and that means keeping ourselves healthy.
That's so true, Lauren, and that's what we're calling now, there is a new word, social distancing, right?
Yes,
we're
I'm going to get to
of
that,
it.
yeah.
But here's the thing, we don't really want to isolate ourselves so much as a preventative measure, because that's going to also cause more anxiety as well as more stress. Now we know stress causes immune system to even suppress more, but we need our immune system to be strong in a time like this so that we can actually fight the coronavirus if we do get it.
So social distancing is important, but stay in touch, still show support,
yes, FaceTime, calling, and having a plan for that. So I think if we're prepared, that takes a little bit of anxiety away. I mean, we're seeing people just taking toilet papers and hoarding all these supplies at home. I think to some degree that's required, and be prepared for it just in case if we are quarantined for up to 14 days. But let's leave some for other people in the stores as well, and not just really deplete and cause more concern and anxiety.
Great point. Okay, so this is probably the #1 question that people have been asking. Is now the time to travel on a plane?
Yes, and it is. It's a question that's on everybody's mind, and especially when we hear in the news and social media how a lot of big events are canceling, and airplanes and flights are kind of canceling their routes as well. But here's the thing, they're charging no change fees at this point. A lot of airlines are doing that to support people and to encourage people, if you are sick, not even just with coronavirus, at this point, if you're sick with flu or cold, just stay home. So it's case by case, Lauren, still at this point. But there are some countries, if you go on CDC website, you can see the travel advisories to certain countries like China. Italy is one of those where it is a travel alert 3. I mean, obviously, those are places you want to cancel your trips at this point.
All right. Right, and just really important to keep our immune system supported, stay healthy.
Yes.
What else should we be doing?
Well, this is the time to really empower ourselves. Your doctors have probably been telling people who have diabetes, who have chronic diseases, that go get exercise, go eat better. This is the time to prepare and maximize our health and really optimize our health, because if we're healthy, our immune system is strong, we can fight not only this disease, but mostly all chronic diseases. So I would say be proactive. If you have been putting off not working out, not going to spend some time outside hiking, walking, whatever that might be, now is the time to take the action and start eating better, start exercising, and start taking care of your bodies.
Dr. Walia, great advice. Thank you so much. Appreciate it.
Thanks for having me.